So the question for you is that, are you one of the patients who feel that you maybe have either a gummy smile, that when you smile you show a lot of gum, or when you smile that you have uneven architecture on your gum, like one gum's higher or lower than the other, or one gum's thicker than the other, or possibly you're the patient who has just maybe where one tooth is not showing as much as your other teeth are showing because your gum is kind of growing over that. Well, that's where the hope comes in with through gum sculpting. You know, I think of a few patients in particular. One is a 16-year-old girl. She's from Canada, quite a sizable distance away from where up here, from where my practice is at. Her mother found a video on YouTube of a patient of mine that we did some gum sculpting on. And she had searched all over Canada, or her part of the area, Canada, and considered orthodontics, considered surgery, and her teenage daughter just did not want to go through all those procedures and have that done. And then she found the gum sculpting video, and she came down here, and within an hour, she did some photos, and with an hour of treatment, we had her daughter's problem corrected, basically non-surgically. I think of another patient who's a hairdresser, and she's a young, attractive woman. She's a hairdresser. She's working with clients all the time, and in fact, she's the owner of a business. And she just felt that she wanted her teeth didn't show enough. And when you looked at her, her gums did cover over parts of her teeth, and she had basically a deficient display of what God gave her, of her natural tooth structure. Part of it, the top part, was covered over. So within a short period of time, we were able to sculpt her tissues, and we did all that without anesthesia. But the neat thing is we can do a lot of this gum sculpting without anesthesia. So the hope is, what we bring is, number one, we can do this with a laser. We can do a lot of the gum sculpting without anesthesia. You can do it without a non-surgical. You can do it non-surgically. And what that really brings to the table, if you do it surgically, you basically have to use a scalpel. And if you're somebody who's a surgeon, you think scalpel. As a laser dentist, you think totally different. I don't have to lay a flap or open the tissue area up. The laser does it all through a closed procedure. It does it through a very simple process of ablation. And what it does, it just takes one little layer away at a time with the laser, and basically it sculpts the tissue and molds the tissue the way I want it to finally look, and where the patient wants it. And you can do this all in one visit. You don't have to wait for 3 to 6 months of healing time, and you can do it oftentimes without anesthetic. And if you have to use anesthetic, you use minimal anesthetic. So what the hope is that that, number one, we can make it more comfortable. Number two, we can do it non-surgically, and number three, the healing is very quick, and also the results are very comfortable afterwards. So gum sculpting is very, very big. It's a very nice benefit for those of you who have uneven gums. If you like this information, and if you're interested and would like to learn more about our services and what we have to offer, and even more about our office, you should really visit us on www.drheringer.com.